My name is Mary Brown McManus. This is my physical final examination. This is Mairead McManus. She is my patient. Mairead, can you tell me the date, time and location today, please?
The date is August 7th, 2016. It's 12 o'clock, and we are in Ferrex Company.
Thank you. We have completed Mairead's vital signs, and they are as follows. Her height is 5'1". She's 115 pounds. Her pulse ox is 60. Her pulse ox saturation is 100%. Her pulse is 66. Her blood pressure is 120/50. Her respiratory rate is 16, and her temperature is normal at 36.8. Mairead, on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever had, can you tell me if you're in any pain today?
0.
Mairead has 0 pain. I will clean my hands now, and I will place my gloves. Thank you. My initial part of my physical exam will include an inspection of Mairead's skull and head. I'm inspecting for any nodules, for any bumps, for dry skin, for any break-in skin. Mairead, do you have any pain where I'm touching?
No.
Next, I will check her frontal and maxillary sinuses. Does that cause pain?
No.
Does that pain?
No.
Next, I'm going to check Mairead's glands, periocular, postocular, occipital, tonsillar, submental, submandibular, anterior cervical, posterior cervical, and supraclavicular. That concludes the examination of the neck and head. Next, I'm going to check Mairead's eyes. On examination, I'm assessing Mairead's symmetry of her eyes. I'm assessing to see and inspecting if there's any exudate. Her sclera are clear. There is no redness noted. Do you have any pain in your eyes, Mairead?
No.
Next, I'm going to check Mairead's pupillary response to light. And just look straight ahead. Mairead's pupils are now reacting to light. I will document that. Next, I will check Mairead's ocular movement. Mairead, please follow my finger. Mairead has no extraocular movement. Mairead, next I'm going to ask you to cover each of your eyes with a piece of paper, and I'm going to ask you to tell me when you see and how many fingers you see. This is our confrontation test. Please cover your right eye.
5. 5.
Thank you. That is great. Next, I will be completing Mairead's ear exam. I will complete a review of Mairead's ears. I will do an inspection of her ears. Her external auditory canal is clear. There's no redness. There's no exudate. Pinna are soft and tender. Do you have any pain in your ears?
No.
The other ear is normal. Again, there's no exudate or swelling or redness or drainage coming from the ear. Next, I'm going to complete the whisper test. Mairead, I'm going to ask that you cover your ear, and when you hear words, please repeat them after me.
Dog, cat, puppy.
Repeat the other ear.
Dog, cat, fish.
That concludes the whisper test. Next, I'm going to be doing the Weber test and the Ringer test. Right, I'm going to ask you to tell me if you're hearing the tuning fork from both ears or one ear, and identify which ear it is.
Both ears.
Tell me when you stop hearing.
No. No.
That concludes the hearing exam. Next I will be doing an inspection of Mairead's nose. I will be checking for nasal alignment. There's no deviation or deformities noticed. Do you have any pain, Mairead?
No.
There's no exudate or redness around the nasal entry. Please. Next I'm going to check Mairead's smell. Right, I'm going to ask that you close one nostril and tell me what you smell.
Coffee.
The other nostril?
Coffee.
That concludes the examination of the nose. Next I'm going to do examination of Mairead's mouth, her lips and her teeth. Her lips are not dry. There's no swelling noted. Please open your mouth. Mairead's teeth are intact. Please stick your tongue out. Her uvula is intact and she still has her tonsils. I'm now going to check for Mairead's gag reflex. Can you say "ah"? Mairead has a gag reflex. Next I'm going to check for Mairead's facial symmetry. Mairead, please do these actions as I ask you. Smile, frown, puff your cheeks, clench your jaws, and now I'm going to ask you to put your tongue inside your cheek and I'm going to check for resistance. Can you please stick out your tongue? To check. Tongue on the side. Oh, sorry, excuse me. That's good. There's no uvula. Everything is symmetrical. There's no swelling or redness noticed. That concludes the examination of the mouth and lips and teeth. Now I'm going to do Mairead's range of motion. I'm going to check all of her joints. Firstly, I'm going to check her elbow joint to see if there's any redness or swelling or heat. There's no heat. I'm going to check her shoulder joints. Does that hurt?
No.
There's no redness or swelling noted. I'm going to check her knee. Does that hurt?
No.
There's no redness or swelling noted. I'm going to check your TM. Can you open and close? And again. That is normal range of motion. Now I'm going to ask you, Mairead, to perform some range of motion exams for me. Can you shrug your shoulders? Can you move your head back and forth? Your neck side to side. Up and down. Can you put your arms out like this? To the side. Can you put your shoulders to the back? Okay. Now I'm going to ask you to stand up. I'm going to check your cervical column. Can you turn around? Can you please bend over? I'm checking Mairead's cervix for any scoliosis or kyphosis. That is normal. Stand up. Turn around. Now I'm going to ask you to walk straight ahead of me, watching Mairead's gait for any spasticity. Straight down. Can you turn around and walk back over that way, please? Now I'm going to perform the Romberg test. Mairead, can you please close your eyes and hold them for 20 seconds. I'm just going to lightly hold you to make sure that you don't fall. Okay, that's good. Open your eyes. Now I'm going to ask you to move your ankle along your shin, please. Both legs. That's good. That's normal. Okay, that's very good. I'm going to have you take a seat, please. Now I'm going to do Mairead's neurological assessment. Part of that neurological assessment is completed, but I'm going to check for light, pain, and sensation. I'm going to touch for lightness. Mairead, close your eyes and tell me where you feel anything.
Shoulder. Arm. Leg. Cheek. Leg. Ankle.
Thank you. Now you can open your eyes. Feel this? This is soft. This is sharp. I'm going to check Maria's response to sharp and soft. Can you close your eyes again?
Soft. Sharp. Soft. Soft. Sharp. 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 Soft.
I'm now going to check Maria's deep tendon reflexes. I'm going to check your bicep. There we go. I'm going to check your brachial. There you go. I'm going to check your tricep. Perfect. I'm going to check your
Knee.
perfect. I'm going to check your Achilles. Perfect. Now I'm going to check your sits. All of Maria's deep tendon reflexes were intact. Marie, I'm going to have you raise your right leg and tell me if you have any pain in your back. Do your leg raise. Does that hurt you?
No.
Okay, can you do it with your left leg, please? Okay, I'm going to check your fingers, your joints, intact. There's no nodules or redness or inflammation. And I'm going to check your hips when you're on the bed. So that concludes the neurological test of the joints. Next, I'm going to do my examination of the lungs. Ready? Please stand up. I'm going to observe Maria's diameter. There is no barrel chest noted. Next, can you turn around, please, Marie? I'm going to palpate and listen for firmitus. When you feel my fingers, can you please say 99?
99. 99. 99. 99. 99. 99. 99. 99.
Thank you. Now I'm going to listen for breath sounds. Each time you feel my stethoscope, please take a deep breath. I'm now going to percuss. There is no resonance or density noted. Right, I'm going to have you turn around to the front. I'm going to check for any abnormalities of the chest. There's no swelling or notice. Do you have any pain?
No.
I'm going to listen to anterior part of your chest. Again, the same as the last time. Just breathe. And now, just gentle. Deep breath. Okay, thank you. That concludes my examination of the lungs. I will now have Marie sit on the bed. I'm going to start with my examination of the lungs. I'm going to observe for any thrills or bruise. I'm going to palpate. Thrills or bruise noted. Now I'm going to listen for Marie's heart sounds. Aortic. Harmonic. Egress. Mitral. Tricuspid. And I'm now checking for API. I'm also going to check for carotid for bruise. Lightly. I'm going to listen with the bell of my stethoscope for any bruise. bruise. Please turn your neck right. And no bruise identified. Next, I'm going to check Mairead's abdominal area. I'm going to inspect it for any lesions or any varicosities. Skin is intact. There's no dryness noted. Mairead's umbilicus is protruding, but there's no exudate or redness around it. Mairead, do you have any pain at the moment?
No.
Okay, I'm going to auscultate for bowel sounds. Auscultate before you do any palpation or any, so that you do not impact bowel sounds. Bowel sounds are present. Next, Mairead, I'm going to palpate on your tummy, so if you feel any pain, please let me know. Pain there?
No.
I'm assessing the 4 quadrants. Now I'm going to palpate. Now I'm going to listen for any other Now I'm going to have Mairead take a deep breath, and I'm going to check, see if there's any pain. Is there any pain when you take a deep breath? No. Okay. That is to determine whether or not the patient has any cholecystitis. And then I'm also going to check, that's the Murphy's sign. I'm also going to check the McBurney's sign, which is an indication for appendicitis. Mairead, tell me if there's, I'm going to press down, and if there's any pain, please let me know.
No.
During the examination, you observe the patient's facial for any expression of pain. I'm also going to, again, palpate. Any rebound tenderness? Any pain?
No.
Pain there?
No.
Okay, thank you. That concludes my abdominal exam. I'm going to now do a vascular exam. I'm going to check pulses, skin turgor, capillary refill. So I'm going to already check your brachial pulse is present, radial pulse. Capillary refill is less than 2 seconds. Okay. Can you bend up both your knees, please? To your pulses are 3 plus. Just relax. I'm going to check post-tibial. 4 plus, ipsilamus cubitus. Checking the warmth of the legs. Legs are warm and dry. No edema noted. Mairead, can you raise your right leg? Thank you. Does that hurt?
No.
Okay, now I'm going to check range of motion in your hip. Okay. Full range of motion in your hip. Now I'm going to complete the genitalia exam. I completed a genitalia exam. The perineal is intact. There is no discharge or redness or any adhesions. I completed a rectal exam. That was normal. The breast exam was normal. There are no inguinal hernias noted, and the inguinal nodes are intact. Mairead, I'd like you to do one more thing for me. I'd like you to take a deep breath. Release. I'm observing to see if there's any hernias, and there is no hernias. That concludes my physical examination. Thank you.